I was so amazed. I've always known that the Clin Ed community is a pretty amazing group of people. But it really, I feel like that when we reached out to ask the NCCE membership, the clinical education community, to mobilize, they did. I mean, we turned around a survey in like 48 hours, and we had like an 80% return rate on that. And we had great feedback to help guide, what do you need? How are we going to do things? What do we need to, pass on to ACAPT to share with CAPT? It was just utterly amazing. And then the same thing when we convened a group together to develop the guidelines for clinical, returning back to clinical education, after having some pause, or what are the principles of having students in the clinic during a pandemic. And again, another group that mobilized, we pulled people together, and within less than a month's time, we had a document with a lot of resources out and disseminated. So again, a very resilient group of people that were willing to collaborate, work together. The crisis didn't pull us apart. I think it brought us together. And so I think it just validated what we all kind of knew and believed.
Mm-hmm. Yeah. And I will kind of emphasize that as well. I think the collaborations that came from it, and within that, Janice mentioned like the creativity, so even in your own environments, if you could shift and do this with your clinical experience, this site can then help out this school and this and that. I mean, it was just, it was really such a joy to see everyone looking at the bigger picture and the greater good. And I think that might be something that's really wonderfully continued moving forward. So I'll reiterate what Janice said there.